Good evening, ladies and gentlemen, and thanks for coming to my presentation on lower back pain. Today we're going to talk about several factors associated with lower back pain, including proper body mechanics for lifting, risk prevention, as well as several exercises that you can do to stabilize core musculature to prevent the risk of lower back pain. I'd like to thank everyone for coming, and hopefully you learned something unique and special today that you may take away and engage in practice or teach family, coworkers, and friends how to prevent lower back pain and live a higher quality of life. In the United States, the cost of low back pain ranges from $38 to $50 billion per year. There are 300,000 operations annually for lower back pain, and back operations are the third most common form of surgery in the United States. You may want to ask yourself the question, are you at risk? Hospital workers experience more low back pain than any other group. Work activities such as bending, twisting, frequent heavy lifting, awkward static posture, psychological stress are causal factors for many low back injuries. So, dependent upon what job you have at the hospital is going to put you at a higher risk for lower back pain. At Lee Memorial, there are 14 separate locations. There are 1,000 doctors, 9,500 employees, 4,500 volunteers, which is about 15,000 people. Statistically speaking, about 9,000 of these individuals are going to be at risk for lower back pain. In regards to the statistics, generalized low back pain over the lifetime may be found in 60% of these individuals who work at the hospital. Each year, over 50% of the employees suffer from lower back pain, 12.8% which suffer from chronic lower back pain issues, and medical care is required in 62% of the time. It's also interesting to know that of those individuals who suffer from lower back pain, 25% will take sick leave from associated complications. Several risk factors that you may want to consider include age, high BMI, smoking, a past history of lower back pain, extra professional activity, years of service, and heavy weightlifting. In regards to prevention, we're going to be talking about several strategies that you may want to employ throughout your workday or throughout your extra activities in your lifestyle. Our goal number one for today is going to learn proper body mechanics while lifting an object from the floor to waist height. So this may be incorporated when you're lifting a patient or several objects or anything throughout the day that requires you to bend over and lift. Goal 2 is going to improve core musculature through several exercises that you may do externally or while at work. And goal 3 is going to learn risk factors associated with lower back pain. And we're going to talk about several behavior modification strategies that you may want to use or try to use to live a healthier lifestyle and improve your quality of life. Do I have any questions right now? Does anyone have any questions that I may help you to answer? So far we're talked about risk factors, and several other ones include increased lumbar lordosis, repetitive heavy lifting, and a sedentary lifestyle. So those are some major factors that we're going to be talking about and how we can change those in your life, or as well as someone that you care about. And just, can I see by a raise of hands, how many people know someone who have lower back pain or any associated complications? Or if you do suffer from yourself, can you please let me know? In summary, lower back pain is a major problem in populations all over the world. A majority of healthcare workers suffer from lower back pain, and preventative medicine is a great way to reduce the risk of suffering from lower back pain. The reason I'm interested in this topic is that I have suffered from lower back pain over the years. I initially sustained stress fractures to my lumbar vertebrae as well as a herniated disc, and it's been a problem for several years. So I've been in tune with my lower back pain and know how to prevent it from happening. So this is why I'm interested in it, and hopefully you may learn something unique and special from me today. Once again, we'll get started with the activities in just a moment.